You're listening to Ask Dr. Jake. My name is Dr. Jake Tucker. I'm the owner and founder of Good Life Family Chiropractic here on the south side of Lincoln, and we're coming to you today with another message of hope, health, and wholeness. And we do this every weekday morning at 9:30, every weekday at evening at 10:15 p.m. You can join us on KCRO. You can also tune in wherever you download your podcasts. And if you like what you're hearing, if you want to support this channel, probably the easiest way to do that is go to the iTunes store, find our podcast, and give us a 5-star rating. I'll read off a few of those on air, but we get reviews all the time for our office and for our practice. Our patients love the care that we're provided here, but to keep this show going, absolutely, it needs you to tune in every single day. Share this with your friends. If you're following on our Facebook page, facebook.com/AskDrJake, make sure you're clicking share, you're clicking that like button, and that you're following the page to receive notifications of when we're putting these videos up. But I wanted to talk to you today about one of the most common questions I get, and it's just going to be illustrated by a phone call that we got on Monday morning this week. A patient or soon-to-be patient called in, and she asked if we could help with her husband's very specific type of dementia. And my CA came to me, and because she'd never heard of this type of dementia, it's one of those things that gets mentioned in school in some of the neurodiagnosis classes that we have, but it's very rare to get a specific type of dementia like this one. And I told her to tell the caller, the young lady that was calling in, the same thing that I would tell you if you asked about anything, that absolutely we have helped people with that condition. I've been doing this long enough. I've seen it all, literally just about every single condition walk into my office. But it's not because we're treating the condition itself. We have to get out of this mindset of treating a condition, treating a diagnosis, because we don't do that. What we do is we assess the spine and the nervous system specifically for interference that's contributing to the malfunction that leads to that disease. And as we start to affect the function of the central nervous system and the function of the way that your body heals, then your body starts to heal and the diagnoses go away. I don't treat heart disease. I don't treat cancer. I don't treat diabetes. But have I seen every single one of those conditions improve under chiropractic care? The answer is absolutely yes. Whether it's back pain or neck pain or headaches or the worst possible medical diagnosis, the most rare medical diagnosis out there, if your nervous system is inhibited, then your body will not be able to heal the way that God designed it to. And let me tell you this, He created our bodies at creation for eternity. He designed us to live forever in these bodies that we were born into. But we started this process of separation. We started this process of being separated from God. And as that happened, we started to suffer the consequences. As I talk about with my children at home, when you make a decision, you suffer the consequences, either good consequences that lead to good gifts. God is the Father of good gifts. Good and perfect things come from God above. But there are natural laws and principles that govern health and healing. And if we interfere with those, if we make choices that interfere with those, we suffer the consequences of interfering with health and healing. And that's where so many of us are. We're sitting there and we've lived 40, 50, 60, 70, sometimes even 80 years, and we haven't invested in our health like we should. Some of us more than others. Some of us have made worse decisions than others, but it's never too late to improve function. And that's where I'm here. That's where there's always hope, is because there's always room for improved function. I've gone to people's deathbeds to adjust them, to make the transition from this life to the next that much more of a functional and fulfilling experience for the person who's about to depart this earth. I didn't adjust them to heal them. I adjusted them so that that experience could be better. I've also gone to people's deathbeds and adjusted them, not so that that would increase the function of that process, but so that we could maintain that life for longer. And very often people have come back from that. No better example than my son Ezekiel. I mean, the doctors had no clue what was going on with him. He had quit breathing in daycare. They'd brought him back. He was seizing. He was struggling to breathe. They were doing all these tests. I found an interference in his nervous system that they didn't even think to check for. Even when I found it, they just kind of nodded politely and moved on to the next test. They didn't believe me that there could be interference in his nervous system affecting the function of his lungs, affecting the function of his brain, coming from his spine. And guess what? Atlas, the top bone of the neck, the bone that's designed to surround and protect your brainstem, it was shoved off out the side of his neck, pressing on the side of his brainstem, pressing on the side of the vagus nerve, pressing on the side of the respiratory center, and affecting the way that his brain was processing the external world, causing it to reset, to try to readapt. And as I adjusted that, his body started to turn back on. His body started to heal. And if he can come back from that without any known diagnosis that any medical doctor in the world could give him other than seizures and sudden respiratory failure, then what else can we come back from? What else are our bodies capable of healing from? And not because we are in and of ourselves amazing healers, but because God placed that ability inside of us. He created us with an amazing innate intelligence that animates every organ, tissue, and cell inside of our bodies. It keeps our heart beating. It keeps our lungs breathing. It heals a cut on our hand or our leg or our arm, all without us even thinking about it. That same intelligence was the intelligence that he put inside you at conception. When the sperm and the egg came together for the very first time and they started to duplicate and replicate themselves 36 trillion times, forming this living, loving, thinking clay, it did it all because God placed it there. It's still animating you. It's still controlling you. You just need to check and see if there's any interference in that process. So does that husband need to be checked with this very specific type of dementia? Absolutely. Does the wife need to be checked regardless of diagnosis? Absolutely. Every single one of us need to have our central nervous system checked. And the only place to have that done is a 5 Essential certified office, one that understands the things that can interfere, not just with the central nervous system, but the healing process overall. And if you haven't done that yet, then pick up the phone and call our office, 531-289-7100. We are the only 5 Essential certified office in the state of Nebraska. In fact, from our office, it's a 3.5-hour drive time to the nearest Max Living 5 Essential certified office from here. So pick up the phone, call us now, 531-289-7100. And for the first 5 of you that call today, you'll be receiving a 50% discount off of exam, any necessary x-rays, first adjustment if it happens on that same day, if we have a condition that's severe enough that I need to see you back here right away. And then from there, we'll make decisions about how to get you healthy and well, not just for today, but for a lifetime. And we do that by addressing the cause. What are those things that we assess? Well, number one, we have to start with the central nervous system. Your nervous system is what controls every other organ, cell, and tissue in your body. If there's interference to that, then we start to lose function. Function, remember, if you've been listening to this show, function is health. Health is not the presence or absence of symptoms. Health is a state of 100% optimal function and healing. As you get less function, you become less healthy. If you're 100% healthy, you can adapt and respond to anything. You can come in contact with viruses and bacteria and germs. You won't develop cancer. You won't develop heart disease because you're functioning at 100%. It's when we have that breakdown over time that starts to happen. And that is controlled by your central nervous system. If we keep that healthy, you stay healthy. Where's your central nervous system? Well, it's your brain, it's your spinal cord, and it's the nerves as they exit out from the spinal cord that go to every organ, cell, and tissue in your body. That is perfectly protected by your spinal column. The spinal column is not just the bones. It's not just the alignment of the bones. It's the interaction between the alignment and movement of the bones and the brain and the muscles and everything that happens in there. When it's moving and in the proper posture, perfectly, then your brain fires at 100%. But if it's misaligned, even 2 millimeters or 2 degrees, that's enough to restrict the amount of function flowing through those nerves by as much as 60%. And 60% decreased function is a major malfunction leading to sickness and disease. We call this state of a misfiring nervous system because of the misalignment of the spine, subluxation, literally meaning less light. It's the most dangerous, most sinister condition out there. And unless you've gone to a 5 Essential certified chiropractor, you don't know if you have subluxation in your spine or not. If you're not regularly getting checked, you don't know if that happens, because how does it happen? Well, that's the other 4 essentials. Thoughts, traumas, and toxins are the 3 T's that we look to tell us whether or not we're subluxated. If our stress is too high and it's consistently too high, that can cause subluxation, and it can actually cause a misalignment of the spine. Don't believe me? Look at someone who's stressed. Look at their posture. Their shoulders hunched. Their head comes forward. Just that head going forward puts so much stress on your central nervous system that we measure a decrease in lung function. A decrease in lung function by over 50%. You're not able to take as deep a breath. You can actually illustrate that right now. Drop your chin down to your chest. Try to take a deep breath in. And then sit up, head back, shoulders back, take another deep breath, and notice the amount of oxygen that you got in the second time compared to the first time. When you sit in good posture, your lung volume increases because the nervous system is less inhibited and those lungs can function better. The second thing, those the traumas, right? I mean, just look at some of our kids. My youngest, Zeke, he had this amazing recovery, still no diagnoses from the doctors, no medical intervention other than the rescue CPR performed by the daycare workers that found him after he had passed out. But he had a trauma. His sister kicked him in the head. Now he's learned how to crawl. He's learned how to pull up. He's going to start walking soon. He's falling all the time. There are constantly traumas. I check my son for subluxation every single day. And some of you have never had your spines checked in your entire life, let alone when you're having these daily traumas to your spine. If it's enough to cause a bruise, it's enough to cause a subluxation. And many of you have been living with these subluxations for years and years, and I can prove it because of something called Wolff's Law. Wolff's Law states that any joint that's been out of alignment, aka subluxation, for even 5 minutes or more, starts to degenerate at a rate of 7% annually into the state of osteoarthritis or degenerative disc disease or degenerative joint disease. If you have those conditions, it's because you were subluxated, whether that's a knee, a hip, or one of your vertebra out of alignment in your spine or in your neck or in your back. That's inhibiting the nervous system outflow and creating interference to the healing process. The third T, toxins. Any toxic exposure inhibits the ability of your nervous system to heal and adapt, and you will have a physical response to that, sometimes in the spine, sometimes in the gut, sometimes in both. And we need to look to see where that interference is coming from. And so if you haven't had this 5 essentials assessment before, if you haven't had your posture checked, your range of motion, if you haven't had a digital nerve scan or a doctor run his hands down your back and see where those vertebrae are out of alignment, that's what you'd be setting up today. That's 531-289-7100 to set up an appointment for this week at a 50% discount. I've been Dr. Jake Tucker. Join me again every single weekday for another episode of Ask Dr. Jake.